Harnessing the demographic dividend, a once-in-a-generation opportunity for Lao PDR. Improvements in healthcare and education, boosted by economic development, are changing demographics globally. Infants and children have higher survival rates, and people are living longer, and the changing patterns of births, deaths, life expectancy, and childbearing impact development and the pace of a country's demographic transition. Lao PDR is in the early stages of this demographic transition. Life expectancy is greater and birth rates are dropping, trends that result in a demographic dividend, the accelerated economic growth potential when the share of the working age population is larger than the non-working age population. It is estimated the population of Lao PDR will increase from 7.1 million in 2020 to reach 8.1 million by 2030, an additional 1 million people in just 10 years. Decreased fertility will lead to a projected drop in the proportion of children aged 0 to 14 from 32% to 25%, or from 2.2 million in 2020 to 2.02 million by 2030. There will be an increase in the proportion of the active working population aged 15 to 64 years, from 64% to 69%, or 4.6 million in 2020 to 5.6 million in 2030, and fewer children and elderly as dependents. Simply put, fewer children to look after and more people of working age could accelerate Lao PDR's economic development, provided those workers are educated, empowered, and employed. This means creating 82,000 new jobs every year until 2030, jobs for workers who are skilled, educated, and who can meet the demands of market. From now to 2030, there is an urgent need to increase enrollment and retention of students in secondary and tertiary education, and to invest in technical and vocational education and training with a focus on 21st century skills. Between 2020 and 2025, there could be an increase in pre-primary enrollment, from 264,000 to 397,000, decreasing to 380,000 in 2030. Numbers of primary school-age students are projected to decline from 709,000 in 2019 to 688,000 in 2030, offering a chance to improve education quality if budgets and investment are maintained. At the secondary level, enrollment numbers are expected to grow from 630,000 in 2019 to 1.07 million in 2030, and investment will be needed to meet this demand. It is projected that 53,000 teachers will be needed by 2030, up from 31,000 in 2019. Increasing teacher numbers will maintain the same student-teacher ratio at around 20 over the same period. The growing population not only needs to be educated but also to be healthy, and for this, more doctors, nurses, and midwives are required. A strong community-based health system can respond to the population needs, but the number of nurses has to rise, from 5,700 in 2019 to 17,900 by 2030. The number of trained midwives from 1,800 in 2019 should increase to 5,800 by 2030. And the number of doctors must rise from 3,700 to 11,700 by 2030. These health professionals will be most effective if they are connected to the network of health facilities. While striving for progress and prosperity to ensure that no one is left behind, Lao PDR needs to strengthen a people-centered approach to planning and budgeting. With about 20 years to go for Lao to complete its demographic transition, investing strategically in skills and the well-being of today's youth, especially adolescents who will enter the workforce, could put Lao PDR on track to harnessing the possibility of accelerated economic growth. All of this requires urgent and innovative solutions, such as the NOI 2030 framework, which, if scaled up, can fulfill the potential of youth for strengthening Laos human capital. Offering comprehensive sexuality education, social protection, and opportunities for women and girls to engage in the formal economy is essential for realizing gender equality and the demographic dividend. Implement policies to reduce child marriage and early childbearing, to promote gender equity, and to eliminate gender-based violence and discrimination. There is an urgent need to increase investment in sexual and reproductive health and rights, contraceptive information, and services focusing on youth. This will allow individuals and couples to decide if, when, and how many children they want. The government of Lao PDR committed to addressing the unmet need for family planning, including among adolescent girls by 2030, at the ICPD 25 Nairobi Summit. The years from 2020 to 2030 must be a decade of accelerated action with highly targeted areas of investment. Urgent implementation of policies, increased investments in the quality of education, secondary school retention and community-based healthcare systems, and diversified economic opportunities, especially for women and youth, can take advantage of this once-in-a-generation opportunity for a demographic dividend in Lao PDR.